Hello, everyone, and welcome to the WMI Mental Health Mini Series. I'm Justice Osemede from Nigeria, a pharmacist, and today I'll be talking about substance use disorder. So, I would like to start with a famous quote in the medical world by a man known as Paracelsus, and it says, "All things are poison, and nothing is without poison. Only the dose makes a thing, not a poison." So, in other words, any substance can be harmful. The difference lies in the amount. So, substance use disorder is the persistent use of any substance despite its harmful effects on health, well being, and especially on our mental health. So, it's the consistent use of a substance despite its negative effects on our well being, on our health, on our relationship, and even in our communities at large. So when we talk about substance use disorder, we're not just talking about drugs. We're talking about substances that include alcohol, tobacco, nicotine, prescription medicines like opioids, like the painkillers, the sleeping pills, and even illicit drugs like cannabis, cocaine, and heroin. So the first question I would like to address is, why do people start using substance? Why do people engage in substance use? So the thing is, some people begin out of curiosity, some begin out of a need to feel good, some begin because they need to fill an emotional void, some begin because of pressure from academic stress, pressure from work, and some also begin under the influence of peer pressure. So why the short term effects of substance use seem to be rewarding? Over time, the brain adapts, leading to a condition known as dependence. Dependence talks about a situation whereby the individual, the person, is not able to go about his normal function except using the drug, without the use of the drug. So it refers to a situation whereby the individual is not able to concentrate, is not able to face his academics, is not able to go about his day-to-day activities without the use of this drug. And this leads to serious health complications, leads to financial problems, leads to family breakdown and relationship breakdown. And sadly, sometimes it could result to premature death. But here's the important part: substance abuse is preventable and treatable. And prevention starts with awareness through education in our schools, by having open family conversations, through positive peer support. And also, treatment is available to those who are facing substance use disorder. And treatment options range from counseling to medical care and even to community based rehabilitation. And most importantly, recovery is possible for those with substance use disorder. So many people who have struggled with substance use disorder in the past are now living healthy, meaningful, and impactful lives. So, in closing, substance use disorder is not just so much about the substances, it's about the relationship affected, it's about the health conditions it causes, and also about its effects on our community. And so, with awareness, with compassion, with the right support, healing and recovery are always possible. Thank you very much.